Patient: I know you're a doctor, but I want to meet the doctor. Doctor: you've already met the resident. I'm the doctor doing your procedure. Doctors of Reddit: what's the stupidest patient you've ever had? Had a patient come in stating that he couldn't bend his knee. I asked him to remove his trousers so I could examine his leg. After he removes his trousers, the reason that he couldn't bend his knee was that he had a plaster cast around his knee. Checking his notes, he had been sent numerous letters asking him to come in for removal of this plaster cast, and as he hadn't attended any of the outpatient clinics, the hospital had assumed that he had removed the cast himself. I had a mom and grandma bring their 12-year-old daughter/granddaughter to the emergency room because she was bleeding. Not from trauma or a wound, mind you. The poor girl had started menstruating and the mom didn't want to explain what was happening or started to happen, nor that it would continue to happen, as mom and grandma well knew. On the upside, it was a very quick ER visit once they were actually seen. I had to explain to a 17-year-old girl and her mother that she was not in fact allergic to alcohol, but she was just hungover. She complained that on nights when she drank too much vodka, usually on an empty stomach, that she would feel nauseous, flushed, and sometimes vomit in the morning. But it didn't happen all the time, and there were no other typical symptoms of an allergic reaction. Irate mom who wanted to speak to the doctor because we took an unauthorized urine pregnancy test on a 16-year-old daughter just before x-rays. I never consented and now she's traumatized. Explained that it is standard in females of childbearing age and that consent to treatment was signed upon entrance to the facility. Not good enough. They were rich Southeast Asian and I suspected that this routine standard was perceived as an insult to their status. I once had a child who swallowed a sizable magnet that passed to the intestine and we were just waiting for it to pass in the stool. The next day when he came for follow-up, we just found out that he swallowed another one that got stuck to the first magnet in the intestine through the stomach wall, resulting in intestinal obstruction, and he was transferred to OR immediately to have them surgically removed. I worked at a pain management clinic. In an attempt to combat opioid use/addiction/abuse, a lot of patients were prescribed a medicated cream. It looked a lot like sunscreen, and you just rubbed it onto the hurting areas. I watched the nurse carefully and slowly explain how to rub it onto the skin, using small, uncomplicated words and going through the motions of applying it several times. But every so often, patients would complain that their cream tastes bad. Paramedic: I got a call for a stroke. The patient had facial droop and slurred speech, says that it feels just like the last time she had a stroke, 10 years ago. Says that the symptoms came on about 4 days ago and she knew the moment it was happening that it was a stroke, but didn't go to the hospital because she thought she could make it go away on her own. My dad is an orthopedic surgeon who does a lot of hips and knees and cries with laughter every time he tells the story of a woman who didn't understand how hip surgery works and thought they were going to take her leg off, fix the hip, and then reattach her leg. A guy came to the outpatient clinic with a swollen left ball. He said he was injected with some cajeput oil by his friend, with his consent, to enhance his performance in bed. I'm a female medical intern and I tried so hard to keep my expression as neutral as possible. There was a 24-year-old patient who was brought in from a jail in a rural county. He was working roadside cleanup when he found a bottle in a ditch that he thought contained alcohol and he quickly chugged it down. To be fair, it did look like whiskey. It wasn't. It turns out it was a substance that contained sulfuric acid. Its pH was less than 2.5, it just ate up the litmus paper. So shortly after he gets to the ICU, he is in excruciating pain and vomiting blood. The gastroenterologist took him to do an EGD, basically a procedure where they can look at the esophagus, stomach, and duodenum with a camera attached to a flexible tube, and the pictures were horrendous. You could literally see his stomach and esophageal mucosa eroding away. He had to be sent off to another hospital where they had an esophageal surgeon who could repair the mess. He, of course, needed multiple surgeries and had a very long hospital stay. I saw him a few months later when he was admitted to another issue. He was down to 90 pounds, from about 150, and was getting fed through a PEG tube. He was very lucky to be young and otherwise healthy, but obviously not very smart. Paramedic here. Called for a diabetic. I get there and the patient is an older gentleman who is laying on a bed with what looks like a white mask on. I ask what's going on, and the family goes on to explain that he's a diabetic and the doc told them to give him frosting if his sugar gets low because the sugar content will perk him up. Turns out he didn't explain that they should put it in his mouth. That's right. They put a white frosting mask on this poor guy. Shocker, it didn't work. I have a few examples. Patient who recently been diagnosed with diabetes, we needed to adjust her blood sugar levels but she kept eating sweets. So we had a talk for like 30 minutes with her about not eating sweets and so on. She seemed to understand. 5 minutes after the conversation she went around drinking a soda. Another guy who had a benign arrhythmia, the heart beats irregularly. He knew that he could get arrhythmia from time to time, but as long as he didn't faint or got any pain in the chest he could just take a beta blocker and let it pass. But he went to the ER like 6 to 7 times before he understood that we couldn't do anything. One patient came in for something, can't remember what, and when we ran tests we found that he had a pH of 6.97. That is on the border of what the body can have and still have any function at all. Read, he should be dead. But he was awake and clear. We wanted to admit him to the ICU and adjust it with the utmost care. But he needed to go home. To eat a shrimp sandwich. Yes, a shrimp sandwich. We sat down and talked to him and his mother for 30 minutes that no shrimp sandwich in the world is worth your life, and if there is something else you need to get help with we can help him. But nope, he left. He came back a couple of hours later and we cured his acidosis. But that must have been a mean shrimp sandwich. Nad, however, recently talked to a patient that is getting ready for surgery that involves the usage of robotic arms to help remove the tumors. It allows for smaller incisions and greater precision. This patient starts insisting to meet the doctor when it seemed like the consult was wrapped up. So we get him back in there, thinking maybe she's got another question. The patient says, I still want to meet the doctor. And the doctor points at himself and says, I'm the doctor. Patient, I know you're a doctor but I want to meet the doctor. Doctor, you've already met the resident. I'm the doctor doing your procedure. Patient, no, not you. I want to meet the robot that's going to do my surgery. I feel like we should at least shake hands first. Apparently, the patient was expecting some metal man to walk through the door. The patient also had cancer cure recipes and was insistent we take notes. I was asked by a patient, on the respiratory ward, if I thought his lung cancer might have had anything to do with his 50-a-day smoking habit. Because he smoked roll-ups, and he wasn't sure if they counted. I struggled to keep a straight face and said yes, and busied myself in his chart. My wife is an RN who works at an outpatient surgery center. Cataract surgery is one of the common surgeries that they do. Patients are told that after the surgery, they should put eye drops in 4 times a day for 1 week, so 28 drops altogether. One patient asked if it would be okay to just put the 28 drops in all at once so they didn't have to deal with it for a week. Maybe the guy who had previously had an anaphylactic reaction to foodstuff, but wasn't sure he was really allergic so thought he'd test it out by bringing some to the waiting room and eating it. Spoiler, he was really allergic. Respiratory therapist here. I was working ER and was told we were getting a patient in respiratory distress. When she gets in she is having problems breathing and needs oxygen. I'm placing an oxygen mask on her and she yells I'm allergic to oxygen. I heard the doctor laugh behind the curtains. My mom works in a hospital, and the techs from radiology always have the best stories. Last week they had a male patient with a huge carrot up his ass. He came from a conservative area, by bus, a standing cause could not sit. It was a 3 hours bus ride. If I ever could change my job I want to be a radiology tech. My one patient used to hold in her farts to the point of being in antagonizing pain because she thought that there was a certain amount of air inside a person, and if you let too much out you'll deflate. Oh, fuck if we're talking stupid ed visits. A woman came in because she got stung by a bee, not allergic, and no reaction. It just hurt. A woman brought her kid in because he got stung by a bee, not allergic, and no reaction. An entire family came in because they found a dead mouse in their apartment. A woman came in for a 2nd-degree burn on her arm. That was roughly the size of a Tic Tac. A woman spent like 5 minutes explaining to me that because of all the vaccinations we give dogs we're seeing a rise in doggy autism. I like to call it autism. The 0-year-old girl and her fiancé find out that she's pregnant. Me, partway through taking her history, do you smoke cigarettes? Her, yay, about a pack a day. Me, you should definitely stop that. Her, well, my sister told me that if I stopped smoking, the baby would go into withdrawal and die. Me, WTF. Had a patient and his girlfriend complaining of fleas. They were covered in red spots that they were picking at constantly. They were meth heads that were picking their skin off and imagining bugs were crawling on them. They were adamant that they had seen these bugs and pulled them out of these sores. Discharge instructions: stop doing meth. A 20-year-old girl came in with abdominal pains. We did a pregnancy test and she was pregnant. She acted surprised because she was on the pill. I asked her how long she's been on it and if she had been taking it daily, as prescribed. As if it were the most logical thing on the planet, she said she did not take it daily because she did not have sex daily. I looked at her trying hard not to laugh. She only took them right after she had sex with her boyfriend, so like maybe a couple of times a week. I had a patient on myopgen rotation who was in her 50s and decided that her clitoris was actually growth and needed to be removed. She came in 3 different times to talk to different residents over a month and would never understand that she's always had it and it's supposed to be there. We even printed off a diagram of normal female anatomy to explain. Then she started saying her urethra was actually the growth and she wanted that removed. We explained she wouldn't be able to empty her bladder without it, and she then demanded her bladder be taken out too. I think she should have been referred to psych. A guy had a really sore ass or something, I don't know. I came late to the party. The nurse had him lying down and told him not to get up or try to go to the bathroom. He did it anyways and a weird brown liquid started to drip down his leg. Turns out, he keistered a root beer bottle. MD here. Saw a young woman in the emergency department. Her primary complaint, per the triage nurse's note, was lethargy, but she was awake and alert when I went to see her. I told her that she didn't look lethargic, and most patients who are lethargic come by ambulance rather than walking into the ED, so I was wondering what she meant. She started to tell me, well, last night while I was sleeping, and I interrupted her because, of course, people are a bit lethargic when they are sleeping. But I caught myself and asked her to continue. She then tells me this story. So last night when I was sleeping, I was talking in my sleep. People have always told me that I talk in my sleep, my family, roommates, you know. So anyway, I was talking in my sleep, and I was saying, Mary, that's my roommate's name, Mary, wake me up. And it was really hard for her to rouse me from sleep. Me, and that's why you're here today? Her, yes. Thank you for watching Reddit Space. Please subscribe if you love these Reddit stories.